Welcome back. Now, in the battle against HIV, experts are saying counseling is critical. Linord Moudou brings us that story. Lino?
Hello, Vincent. Hello, everyone. Well, more than 30 million people around the world are living with HIV. Women and children are one of the most vulnerable populations. Tremendous progress has been made over the years to ensure that pregnant women with HIV/AIDS do not infect their newborn babies. Among other things, experts recommend HIV testing and counseling of pregnant women to ensure timely access to HIV prevention, care, treatment, and safe delivery services. And for more than 2 decades, the Elizabeth Glaser Pediatric AIDS Foundation has been championing the fight against pediatric AIDS. Part of their program is to provide necessary information and counseling to pregnant mothers and ensure healthy mothers and babies. Joining us in the studio is Dr. Appolinaire Tiam, Lesotho Country Director for the Elizabeth Glaser Pediatric AIDS Foundation. Dr. Tiam, welcome to Africa 54.
Thank you very much, Linord.
So we understand that, of course, counseling is very, very important. Tell us in a nutshell what are some of the main aspects when it comes to counseling.
Talking about counseling, especially in the context of women, we have two aspects of counseling: the pre-test counseling and the post-test counseling. In the pre-test counseling, we have two steps, in which case women who have come to the facility to receive care, they are given a group counseling, which is general information about HIV. And when women actually decide to take the HIV test, they are given a one-on-one HIV counseling. And generally, the information given on one-on-one is the probable expectation, because when you go for HIV testing, usually majority of people will have either an HIV positive result or an HIV negative result.
And the whole process is kind of disturbing, really, even when you don't know your status, to go and take that test.
And that's why it is important, you are right, Linord, and that is why it's important to seek care in a setting where you can receive good counseling, because that prepares the patient for the eventuality. And in the post-test counseling, depending on whether the woman is HIV positive or negative, further information is given. In HIV negative women, they are taught how to stay negative. They are also told about the window period, that this test may be negative, but they may just be in the window period.
Window period being?
The window period is the period between infection and the seroconversion. Okay. That means until the virus or the body, your body is showing antibody against the virus.
And usually it's about how long?
It depends on the type of the test. With the rapid test that we use now, it varies between 6 weeks and 12 weeks, okay, depending on the test, the sensitivity of the test. Okay. While for HIV positive women, it is important to explain to them the issue of discordant couple, and also how the opportunity for them to be cared for, especially in the era where we now have good treatment on the continent.
Okay, now let's talk about pregnant women quickly. What do you tell them?
In case of pregnant women, you know, we are now talking about two people, the unborn child and the woman herself. And the WHO recommendation is that we should optimize the health of the woman while preventing the transmission of HIV from the mother to the unborn child, either during pregnancy or after delivery through breastfeeding. So usually these are the things we discuss with the woman. And because the continent now has a lot of medicine to prevent the transmission of the HIV from the mother to the child, those options are given to the mother, and she's taught how to be adherent to her medicine when she's initiated on the medicine. In addition, we also discuss issues of side effects of this medicine, how the importance of sticking to her checkups, and of course the importance of delivering in the facility and following up in the facility.
Okay, Dr. Tiam, that's all the time we have for today. We have to leave it there. And we thank you for being here today. And that was Dr. Tiam with the Elizabeth Glaser Pediatric AIDS Foundation, Country Director in Lesotho. Now that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.